Hello, so today our topic will be on rhabdomyolysis. So rhabdomyolysis is a skeletal muscle dying. So when they die, they release myoglobin, potassium, creatinine kinase. Common scenario and hints. A person was trapped for several hours under the heavy object. A fall followed by a long period of lying on the floor. An elderly with frequent falls presents with acute kidney injury. So basically what happens is that whenever this is a bone and this is a muscle, okay, and this is floor or any rough surface. So whenever you push your muscle against any rough surface or floor or by any means you destroy the muscle cells. So muscle cell will release, suppose this is a muscle cell, it will release, first of all it will release potassium because cells are the bags of potassium. Okay, so the person will develop hyperkalemia. Next, it will secrete phosphate. Okay, so the patient will have hyperphosphatemia. The next thing is creatinine phosphokinase CPK level will be increased. It will be increased at least 5 times that of normal range. Okay, 5 times. Then, because muscle cell has a lot of myoglobin, which acts as a transport for oxygen, uh, and it is also as acts as a reservoir for oxygen. So myoglobin will be released. Okay, and this myoglobin eventually causes acute renal failure. This is very notorious for uh, killing the kidney tubules. Yes, and the next one is nucleoli or nuclei. These nuclei will turn into uric acid, will be metabolized into uric acid. Okay, and the patient will have hyperuricemia. Hyperuricemia. So the patients will have hyperkalemia. This is dangerous to heart. So we give calcium gluconate or calcium chloride IV to protect the heart. Okay, and then the patient will have hyperphosphatemia. This is very important test. This is very sensitive and specific as well. So in order to diagnose the patient with rhabdomyolysis, you can do this test. It has to be 5 times elevated of that of normal range. So in order to confirm the diagnosis, and then comes the myoglobin. Myoglobin is also elevated, and myoglobin is very important. What myoglobin does is that it does three functions. Uh, Rather, it has three adverse effects. It causes uh, renal tubular obstruction, renal tubular obstruction, and the next thing is that it causes renal vasoconstriction, so it decreases the GFR. And the third thing, which is the most dangerous one, is it uh, damages the renal tubules by oxidative injury. Okay, by oxidative injury. Now, so eventually, what will happen? That kidney, it will damage the kidneys. Okay. Now let's read it out. A fall followed by a long period of lying on the floor. An elderly with the frequent falls presents with acute kidney injury. Okay, so everywhere you can see that the muscle is being pushed against the floor or any uh, rough surface or anything. Okay, and then long distance runner, marathon runner, severe exertion, severe. This also applies the same thing. Okay, In during running, as it is energy requiring mechanism, so there are so much channels opened in your cells, so potassium can also leak through cells. And if you are having strenuous exercise which are damaging your muscle even, so you can have rhabdomyolysis. Okay, severe crush injury, again the muscle is pushed against anything. Okay, and exercise induced rhabdomyolysis, then hematuria, red brown urine, myoglobin. Okay, so this is because of the myoglobin. Myoglobin can turn the urine into red color or brown color. That's why most of the people say that on urine dipstick it was positive. When you do your analysis, urine dipsticks becomes positive. But urine dipsticks cannot tell the difference between hemoglobin, myoglobin, and red blood cells. So, in order to diagnose myoglobin, you have to do a test which is called as urine test for myoglobin. Okay, that's it. And then there is hypotension, plus minus. AKI, acute kidney injury, because of the myoglobin, high urea and creat, very high CK, and this is very specific. Myoglobin is a nephrotoxic and thus can lead to acute kidney injury. And therefore, dehydration with IV fluids is an essential initial step. That's why rhabdomyolysis is an immediate medical emergency you have to be aware of. ECG must be performed as a release potassium from the dying muscle. Hyperkalemia dangerous. If ECG changes suggesting hyperkalemia, tall 10-T waves will be present and white QRS will be formed. So then you give IV calcium chloride or calcium gluconate in order to prevent the heart. Okay, remember that these two things are only cardioprotective. Okay, it does not change the serum potassium level. So they are given to just have the cardioprotective effect on the heart. Okay, before anything is now important points. Rhabdomyolysis. Main complication of rhabdomyolysis is AKI. Okay, and hyperkalemia. This is dangerous, and this is dangerous for the heart. Initial management, IV fluid. Okay, so it depends upon the condition. Okay, suppose if they give in the scenario that there is hyperkalemia, what is the initial step? In if you are having hyperkalemia, then the initial step will be do ECG. Okay, and if initial management will be uh, calcium gluconate or calcium chloride. Okay, calcium chloride or gluconate. If they ask the definitive diagnostic test, okay, then your answer should be CPK. Okay, if they ask the initial uh, treatment, okay, then this should be IV fluids. IV fluids should be normal saline. Okay, normal saline, 0.9%, not heartine, because that contains potassium. So potassium is contraindicated in this condition. Now to confirm CPK level creatine phosphokinase, it indicates muscle necrosis. Now I told you before that this is very important, and the best initial test that is specific for rhabdomyolysis, urine analysis. Okay, but urine dipstick will be positive, but there will be no red cells in the urine. Okay, and then falsely positive hematuria. Other line for treatment is sodium bicarbonate and dialysis. Okay, now these two things are very important. Now I will tell you. First one is uh, acidosis. Okay, this person can also develop acidosis. The metabolic acidosis can be developed in severe rhabdomyolysis secondary to lactic acid production from the ischemic muscles and the release of other organic acids. Now, regarding the bicarb, let me tell you something that we need to give this patient some bicarbonates uh, to alkalize his urine, and his urine alkalization should be the pH of his urine should be more than 7. We give sodium bicarbonate until his urine pH becomes more than 7. And this bicarbonate is also helpful to inhibit the myoglobin induced cytotoxicity. Okay, and this sodium bicarbonate also drives the potassium back into the cell. So it has three functions. Okay, first one is that it will derive the potassium into the cell. Okay, let me change the color. It will push the potassium back into the cell. It will decrease the pH. Okay, it will decrease the pH. And the third thing is that it will decrease the effect of the myoglobin. Okay, it will decrease the basically it prevents the lipid myoglobin induced lipid peroxidase. Okay, this is it. And then we give fluids as well. Fluids, yes, the fluids decreases the duration of contact between the nephrotoxic myoglobin and the kidney tubules. Okay, it basically dilutes the myoglobin, so there is less duration of contact between the myoglobin and the tubules. So now you know all the things. Sodium, okay, another line of treatment, and the end treatment is sodium bicarbonate dialysis. Okay, there are some points regarding dialysis. So dialysis can be done when your potassium is very high. Potassium is more than 7 millimole per liter. Okay, or if you have metabolic acidosis, your pH becomes less than 7.2. Okay, and then if you have some creatinine more than 10 milligram per dl. Okay, and some other things like your fluid overload. Okay, like fluid overload or something. Okay, now let's come to the examples. Example number: a man has finished a long distance run, presents with myalgia, red brown. Okay, urine dipstick is positive for blood, but without RBC. So now uh, this is a tip for you, that it is urine dipstick is positive but without RBCs. There are no presence of RBCs. It means this is simple myoglobinuria. ECG shows tall tented T waves, widened QRS, and small P waves. Now, tall tented T waves were present in hyperkalemia. Okay, widened QRS as well. So, what is the initial step? Now, because they have mentioned that there is a risk of hyperkalemia on heart, so you have to give cardioprotective first. The initial step of management is calcium chloride or gluconate. It is obvious that he has a rhabdomyolysis as there are ECG changes suggesting hyperkalemia. We should protect the heart before anything else by giving calcium. First thing first, otherwise IV fluid is the initial step. Okay, if they discuss the heart, okay, or potassium, then go for initial step as a calcium chloride or gluconate. If they overall talk about the rhabdomyolysis features or something, and you have suspicion that the patient might be having acute renal failure because of the myoglobinuria, then you proceed to the NaCl 0.9% first initial step. Okay, and if they talk about the definitive is CPK. Okay, and if they tell you about the investigation regarding the hyperkalemia, then answer should be ECG. Okay, and regarding the ARF, you can do urea electrolyte, but they won't ask you. The main things are this ECG or calcium initial steps. In heart, initial steps are different, and the acute renal failure, the initial steps are different. Now, the next one is a 24-year-old mountain climber was rescued after being trapped. Now, again, the same thing. Okay, his muscle is uh, damaged. Okay, it is pushed between the bone and the rock. Okay, he has a dark urine with impaired creatinine and urea. Okay, there you go, acute renal failure. So his BP is 100 and heart rate is 125. The most appropriate management. Okay, so now they are talking about the asking about the most appropriate management. So this will be IV fluid and normal saline. What I told you that IV fluid will dilute the patient. It will increase the GFR and it will dilute the myoglobin and it will decrease the duration of contact between the myoglobin and tubules. The likely cause of his renal failure is myoglobin, which is renotoxic. He has rhabdomyolysis, skeletal muscle breakdown due to crush injury or prolonged immobilized muscle. As the question did not mention ECG changes or hyperkalemia, the initial step would be IV fluid rehydration to try to avoid further renal damage. Then myoglobin is nephrotoxic. Okay, and 22-year-old known HIV patient was found comatose on the floor by his friend. He was not seen 2 days. On the ED, the patient is confused and disoriented as lab revealed serum urea level of 47. Okay, it is very high. Hyperuricemia, and you can see creatinine is also high. Sodium is normal, potassium is also high. And the best investigation to perform is CK. Okay, so this is a normal case of rhabdomyolysis. They are just asking about the best investigation overall, so that is CPK or CK. Prolonged immobilization in coma, muscle ischemia, release of the myoglobin, creatinine kinase, potassium, and others. Acute kidney injury as seen here. To confirm serum CPK, creatinine, phosphokinase, note if potassium T in ECG option is given, pick it, especially if the questions are the initial step. Okay, same. If there is hyperkalemia, the initial should be ECG. Okay, so this was it. One thing more, that myoglobin can also attach to calcium. Okay, so it can lead to hypocalcemia, but you don't have to treat the hypocalcemia, because in recovery the calcium will come on its own. Okay, come to normal on its own. So this is it.